One of the most important glands in the body, the thyroid is located in the neck and has the appearance of a little butterfly. Its primary job is to regulate the body's metabolism, energy levels, and overall health. When its hormone production diminishes, it can lead to a variety of prominent symptoms that should not be ignored. These symptoms should not be ignored. In today's informative video, we will discuss several typical symptoms that may indicate that you are taking in an insufficient amount of thyroid hormone. This will enable you to remain aware and take the required steps to ensure your health. Before we move on, I would like to make it clear that everything that is discussed in this informative video has been thoroughly researched, confirmed by experts in the field of medicine, and is completely objective. In today's video, we will discuss the 7 indicators that you are experiencing a deficiency in thyroid hormone. So, now let's get started. Number 1. Hair loss. Thyroid function and hair loss are related because of the intricate hormonal balance that exists in the body. The thyroid gland specifically produces hormones necessary for hair follicle development and renewal. Thyroid hormone levels that fall below normal can cause a disturbance in the hair development cycle, which can result in excessive hair shedding and thinning. Patients with hypothyroidism may experience hair loss on additional body parts in addition to their scalp. Moreover, the effects of thyroid hormone shortage on hair extend beyond hair loss. They can also change the texture and quality of the hair that is still present, making it more brittle, dry, and prone to breaking. Along with other hypothyroidism symptoms, including weight gain, lethargy, and sensitivity to cold, this change in hair texture frequently occurs. A thorough evaluation by a medical practitioner is necessary to diagnose the connection between thyroid function and hair loss. A comprehensive review of the patient's medical history, a physical examination, and certain blood tests to determine the thyroid hormone levels are usually included of this assessment. Hormone replacement therapy is the standard of care for hypothyroidism once a diagnosis has been made. Its goal is to balance the body's thyroid hormone levels and treat the resulting hair loss. Number 2. Dry skin. Hormones that control a number of body processes are produced by your thyroid. Among these is the hormone in charge of preserving skin health. Lack of this essential hormone production by the thyroid can result in dry, flaky, and itchy skin that is insensitive to moisturizer. Your skin feels rough, scaly, and sometimes even cracked as hormone levels fall because it can no longer hold on to moisture as well. It can greatly affect your comfort and self-confidence, so this is more than simply a passing worry. The first step in treating possible thyroid problems may be to determine the relationship between dry skin and thyroid function. Talk to your healthcare practitioner if you continue to experience dryness in spite of your skincare regimen. You can find out if your thyroid hormone levels are within normal range or if they could be causing your skin issues with a straightforward blood test. Number 3. Fatigue. Experiencing fatigue and lethargy may occasionally indicate a more serious problem with our bodies. If you struggle with weariness all the time, it may be a warning sign of a possible thyroid hormone issue. Fatigue is one of the most noticeable and early warning indicators when this gland is unable to produce enough thyroid hormones. The way our bodies use energy is influenced by thyroid hormones, particularly thyroxine and triiodothyronine. The body's metabolic rate drops when these hormone levels go too low, which has a series of negative repercussions that include a strong sense of exhaustion and poor energy. This exhaustion can be incapacitating, making it difficult to carry out regular duties and frequently leaving you feeling exhausted and unable to concentrate on the work at hand. In addition to producing additional symptoms including weight gain, brittle hair, dry, chilly skin, and sensitivity to cold, low thyroid hormone levels can also upset the equilibrium of other body systems. Beyond merely affecting a person's physical health, this illness can also cause mood changes, melancholy, and difficulties focusing. In order to get the right medical care and address the underlying cause of the weariness, it is essential to recognize these symptoms and comprehend how they may be related to thyroid function. Number 4. Weight gain. When it comes to our bodies, there are a lot of reasons why we gain weight, some of which are not immediately obvious. Thyroid hormone balance is one such cause. The thyroid gland secretes hormones that regulate the body's energy utilization, impacting essential bodily processes including body temperature and heart rate, as well as the pace at which food is either stored as fat or transformed into energy. Hypothyroidism is a disorder in which the thyroid gland produces insufficient amounts of certain hormones. Unexpected weight gain is one of the primary signs of hypothyroidism, since it frequently happens in spite of attempts to maintain a balanced diet and exercise regimen. Weight gain linked to a sluggish thyroid can be confusing and upsetting. This is due to the possibility that a drop in thyroid hormones could result in a slowdown of the body's metabolic rate, which would make it harder to burn calories effectively. As a result, more calories may be stored as fat, which can cause weight gain that happens gradually over time. Number 5. Muscle weakness. One common sign of hypothyroidism, or an underactive thyroid, is muscle weakness. Millions of people are impacted by this illness, which can arise for a number of causes. Occasionally, it results from an autoimmune condition known as Hashimoto's thyroiditis, in which your thyroid is attacked by your own immune system. In other cases, it may be the consequence of an iodine shortage or specific drugs. The problem is that muscle weakness tends to develop gradually. You may not feel it at first, but as it worsens, it can become quite difficult to perform daily tasks. You may find it difficult to carry groceries, walk stairs, or even lift your children. It can cause more than simply weakness. It can also result in pains, spasms, and stiffness in the muscles. Number 6. Constipation. In the digestive tract, thyroid hormones have an effect on the muscles, which helps to ensure that they continue to move in a smooth manner. It is possible for these muscles to slow down when your thyroid is not functioning properly, which results in food and waste moving through your intestines at a slower rate. Congestion is a potential consequence of this delay. Other factors include the fact that thyroid hormones play a role in maintaining the proper fluid balance inside the body. It is possible that the body will not be able to keep the appropriate quantity of moisture in your intestines when these hormones are low. This will result in stools that are tough to pass and extremely difficult to pass. When you have hypothyroidism, your general energy levels may decline, which is another symptom of the condition. It is possible that the coordination of your intestines will be affected when you do not have the energy to perform the necessary body tasks. This will result in your intestines being less effective at passing waste through your system. Number 7. Joint pain. Your bones and joints' general health is greatly dependent on thyroid hormones. Your joints' sensitivity, stiffness, and soreness during movement can all be directly impacted by low levels of these vital hormones. By highlighting the possible interactions between thyroid function and joint health, this relationship highlights the significance of helping people become more aware of their bodies and seek the right medical advice when they are dealing with chronic joint discomfort. The connection between joint pain and thyroid hormone levels emphasizes how important it is to have treatment and diagnosis as soon as possible. While there are many other causes of joint pain, such as aging, trauma, or underlying medical diseases, understand the possible significance of thyroid health can encourage individuals to seek out thorough medical evaluations, allowing for the early diagnosis and treatment of thyroid-related problems. Individuals can potentially prevent the progression of thyroid-related issues and minimize the impact on their general well-being by proactively addressing underlying health concerns, such as joint discomfort, which may be a symptom of low thyroid hormone levels. Final words. If you want to keep your general health in good shape, it is essential that you are aware of the symptoms of low thyroid hormone. In order to receive an accurate diagnosis and treatment, it is imperative that you seek the advice of a medical expert if you have any reason to believe that you might be suffering any of these symptoms. It is important to keep in mind that taking care of your thyroid health is an essential component in ensuring that your body performs fully, which in turn enables you to live a life that is both healthy and balanced. Have you found this video helpful? Please click the like button and subscribe to our channel so that you may watch further helpful videos that are similar to this one. Our goal is to ensure that you are healthy, so thank you for watching.